Welcome to my channel I Love Pharmacology. Today let's learn about 5 must know points about paracetamol poisoning. So coming to the first point, how much dose of paracetamol causes toxicity? Normally in adults, the dose of paracetamol should not exceed 4 grams per day. So in pediatric age group, the normal dose is 15 milligrams per kg body weight. So when do we say it as paracetamol poisoning? So when the dose of paracetamol exceeds 4 to 5 grams per day, it is called as toxic dose at which you can encounter the signs and symptoms of paracetamol poisoning. So second important point to know is who are more prone for paracetamol poisoning. So first is the children's because they have got low glucuronide conjugating ability than adults. In case of adults, those who are having hepatic dysfunction can be more prone for paracetamol poisoning. And chronic alcoholics have capacity to induce more and more cytochrome P450 enzyme, which will lead to more and more production of toxic metabolite that can lead to paracetamol poisoning. So third point to remember is what happens in case of paracetamol poisoning. So normally majority of the paracetamol at therapeutic doses undergoes major pathway. In case of paracetamol poisoning, this major pathway gets saturated. So whatever the glucuronide as well as sulfate conjugation which is present in the liver gets saturated. So once it gets saturated, the major pathway will be inhibited, or you can say the major pathway gets halted. So at this time, the minor pathway gets activated and even the cytochrome P450 enzyme gets activated to produce a toxic metabolite which is called as N-acetyl-P benzoquinine imine. So fourth point to remember is what is the fate of N-acetyl-P benzoquinine imine. So at normal therapeutic dose, the N-acetyl-P benzoquinine imine production will be less and it gets conjugated with glutathione which is present in the liver and it gets converted into non-toxic metabolite which will be excreted out. So at toxic dose, what happens is liver has got limited amount of glutathione and these glutathione stores gets depleted at high N-acetyl-P benzoquinine imine concentration. So the more and more N-acetyl-P benzoquinine imine will oxidize the SH group in the hepatic and renal cell proteins to cause cell death. So fifth important point is how to treat the paracetamol poisoning. So here you need to remember two drugs, that is methionine which can be given orally and N-acetylcysteine which is given intravenously. So you can say the preferred or the antidote or the drug of choice in case of paracetamol poisoning is N-acetylcysteine. So these two drugs will help in more and more production of glutathione and N-acetyl-P benzoquinine imine gets conjugated with glutathione to form a non-toxic metabolite for getting excreted out through urine. At the same time, methionine as well as N-acetylcysteine directly conjugates with the N-acetyl-P benzoquinine imine to form a non-toxic metabolite and it gets excreted. So this is all about paracetamol poisoning. If you like this video, please do subscribe to my channel for more and more videos on medicine. Thank you.